Hello everyone, this is Xiaodan Liu from USC. It is a great honor for me to present my study at ISMN this year. I have no financial interest or relationship to disclose. The glymphatic system is a discovered putative clearance pathway within the central nervous system, which facilitates the clearance of the waste solute from the brain via the ISF-CSF exchange. The glymphatic system dysfunction was thought to be involved in the pathophysiology and probable etiology of cerebral small vessel disease (CSVD), as well as vascular cognitive impairment and dementia (VCID). However, how changes in the glymphatic system affect cognitive function in CSVD is still poorly understood. Diffusion tensor image analysis along the perivascular space (DTI-ALPS) is an approach to evaluate the water movement in the direction of perivascular space. Lower DTI-ALPS index was reported to be associated with impairment of glymphatic clearance function in CSVD and VCID. DTI-based free water enables the extraction of the extracellular water content from the tissue compartment. Higher free water was demonstrated to be linked to cognitive decline in older individuals with vascular risk factors. This study aims to test our hypothesis that if lower ALPS index indicated dysfunction of glymphatic clearance would result in accumulation of free water content, and if excess free water mediates the association between glymphatic clearance dysfunction and cognitive decline in executive function. 4 independent cohorts with middle to aged, diverse in terms of race and ethnicity, and vascular risk factors were examined. The DTI data were acquired using a single-shot diffusion sequence with about 30 directions. Our in-house ALPS pipeline and MARC VCID free water kit were used to calculate ALPS index as well as free water in the white matter area. Multiple linear regression models were used to evaluate the association between ALPS index and executive function, regressing out of covariates, including demographics, presence of vascular risk factors, white matter hyperintensities, as well as DTI-derived matches. The mediation analysis was used to further test the mediation effect of white matter free water on the association between ALPS index and executive function. The ALPS index exhibited significantly positive association with the scores of executive function in all 4 cohorts after adjusting for the demographics, vascular risk factors, and the white matter hyperintensities. And the white matter free water mediated the association between the ALPS index and the scores of executive function in all 4 cohorts. We also found that the association of ALPS index and executive function as well as the mediation effect of white matter free water were not affected by the mean diffusivity, functional anisotropy, and the radial asymmetric patterns of projection and association fibers. We draw the conclusion that lower ALPS index may be a surrogate marker of glymphatic dysfunction, which is associated with impaired executive function. The association between ALPS index and executive function is mediated by ISF accumulation in white matter, providing a clinical rationale for using ALPS index as a biomarker for CSVD-related VCID. Finally, I would like to thank my PI Dr. Wang and my dear colleagues Dr. Giuseppe and Pauline's help with study design and data analysis, as well as the support of our collaborators and consortiums.